If you're over 60 and still masturbating the same way you did in your 30s, you could be causing serious damage to your circulation, your prostate, and your nerve function. As a urologist with 25 years of experience, I've seen the consequences of men who never learn to adapt their technique to their aging body. Today, I'm going to explain exactly how to masturbate safely after 60. The 3 critical mistakes that could be harming you right now, and the warning signs that mean you need medical help immediately. I'm Dr. Recheal, a board-certified urologist and men's health specialist. Over the past 25 years, I've treated thousands of men facing the hidden complications that arise when they don't adjust their habits to match the natural evolution of their bodies. This is a conversation that's long overdue. Most doctors shy away from it, but I'm here to break the silence because masturbation after 60 isn't just about pleasure. It's about protecting your long-term health. Done right, it can boost your prostate function, keep blood flowing where it matters, and even lift your spirits. But ignore the changes in your body, and it can lead to issues that steal away your vitality and confidence. Let's dive into the science first, because understanding why things change is the key to making smarter choices. Masturbation itself doesn't turn harmful as you age. Far from it. Gentle, mindful self-stimulation can actually be a powerful ally, helping to flush out prostate fluids, maintain erectile tissue elasticity, and support overall nerve health. Studies from institutions like the Harvard Health Letter back this up, showing that regular orgasms can lower the risk of prostate issues in older men. But here's the catch. Your body isn't the same machine it was decades ago. Starting around age 30, testosterone dips by 1 to 2% annually, but after 60, that drop can feel like a steep slide, affecting everything from arousal speed to recovery. Your blood vessels lose some of their youthful bounce due to shifts in proteins like collagen and elastin, which means erections might take longer to build and feel less robust. Nerve sensitivity fades too, what experts call peripheral neuropathy, or age-related sensory decline, slowing down those electric signals between your body and brain. And don't get me started on the refractory period. What used to be a quick reset in your younger days can now stretch into hours or even days, leaving you feeling wiped out if you push too hard. The real danger? When men stick to old routines without adapting, they unwittingly set the stage for problems that ripple into every aspect of their intimate life, from solo sessions to time with a partner. I've had patients walk into my office frustrated, embarrassed, and in pain because years of unadjusted habits led to chronic inflammation or diminished sensation that could have been avoided. So let's unpack those 3 big mistakes I mentioned, the ones I encounter time and again in my practice. These aren't just minor slip-ups. They're patterns that can snowball into irreversible damage if left unchecked. By sharing real stories from my patients, with details changed for privacy of course, I'll show you how to spot them in your own life and steer clear. The first major pitfall is relying on too much force, gripping harder, or applying intense pressure to chase that familiar feeling. It's a natural reaction when sensitivity dips. You think, if I just squeeze a bit more, it'll kick in. But trust me, this is a recipe for trouble. Anatomically speaking, the penis is a marvel of delicate engineering, those spongy corpora cavernosa chambers that swell with blood, wrapped in a network of fine nerves and capillaries. Ramp up the pressure repeatedly, and you're essentially bruising these internals. Over months or years, it can trigger what's known as traumatic neuropathy, nerve damage from constant micro-injuries. I've examined men who've lost patches of feeling entirely, describing their skin as numb like leather, all because they escalated force to compensate for age-related changes. Worse still, those tiny blood vessels can scar, impairing blood flow and making erections unreliable, even when you're excited. One patient of mine, a retired engineer in his late 60s, came in after noticing he needed a vice-like hold to finish, something that made partnered sex awkward and unsatisfying. We traced it back to decades of aggressive solo habits. The fix? It's all about recalibrating to gentleness. Begin with the softest touch imaginable, like a feather gliding over skin, and give your nerves a full minute or 2 to wake up. Build from there slowly, always keeping your grip loose enough that you could slip a finger underneath. Imagine you're coaxing a response rather than demanding it. It's about partnership with your body, not conquest. If this resonates with you, I encourage you to hit that subscribe button for more insights on aging gracefully. My upcoming video dives into surprising, everyday habits that sabotage your energy levels, and it's packed with tips you can use right away. Moving on to the second mistake, which trips up so many. Masturbating too often without respecting your body's new recovery needs. Back in your prime, daily or even multiple sessions might have felt energizing, but after 60, that rhythm can backfire spectacularly. Let's break down the biology. Your prostate gland, that walnut-sized powerhouse, churns out key components of semen, and it doesn't bounce back as quickly anymore. Overdo it, and you risk swelling or irritation, prostatitis in medical terms, which brings discomfort, frequent bathroom trips, and sometimes a nagging ache. Hormonally, frequent climaxes can throw off your delicate balance of testosterone and other messengers like luteinizing hormone, leaving you foggy-headed or low on drive. In my clinic, I've coined the term overstimulation slump for guys who push daily habits and end up with orgasms that feel flat, take forever, and drain their batteries. Think about it. Your system needs time to recharge, just like a smartphone after heavy use. From what I've observed in thousands of cases, aiming for every 2 to 3 days hits the sweet spot for most, enough to reap the benefits without overload. One gentleman, a former athlete now in his 70s, switched to this schedule on my advice and told me his sessions became like fireworks again, with better stamina and mood to boot. It's a shift towards savoring depth over chasing volume, and it pays off in spades. The third error that's alarmingly common is going in dry. Skipping lubrication altogether, as if it's optional or just for partnered play. Oh, how I wish more men knew this isn't true, especially later in life. With lower testosterone, your natural pre-ejaculate thins out or vanishes, and penile skin gets more fragile, prone to tiny fissures from friction. These aren't dramatic wounds, but they're gateways for bacteria, inviting infections like balanitis that cause redness, itching, and pain. Repeat this cycle, and you might develop fibrous scarring that dulls pleasure permanently. I've counseled men who've dealt with chronic soreness for years, all stemming from this one oversight. A vivid case, a widower in his mid-60s who thought real men don't need lube until recurrent flare-ups landed him in my office. We turned it around with a simple routine. Always start with a generous dollop of quality, water-based lube, scent-free to avoid irritation. Steer clear of petroleum-based options if condoms are in your future, as they degrade latex. Favorites from my recommendations include Sliquid Organics or Astroglide Natural. They're gentle, effective, and widely available. Apply it from the get-go, letting it enhance every stroke. It's a small step that safeguards your skin and amplifies enjoyment. Now, pulling it all together, here's my comprehensive guide. What I call the gentle flow protocol for masturbating safely and satisfyingly after 60. Think of it as a roadmap tailored to your evolving needs. First, set the scene with mindfulness and prep. Wash up thoroughly. Choose a serene spot where you won't be rushed. Maybe dim the lights, play soft music. Position matters. Opt for lying back with pillows for support or on your side to ease any back strain, avoiding cramped seats that pinch nerves. Next, embrace lubrication as your foundation. Slather it on before you even start, warming it in your hands for comfort. Begin with whisper-like caresses, exploring not just the shaft but the whole area, letting arousal ebb and flow like ocean waves. Use varied strokes, circles, up and down, perhaps incorporate gentle testicular massage to boost circulation without intensity. If tools appeal, consider a soft silicone sleeve for even pressure distribution. It takes the guesswork out of grip strength. Pace yourself. Aim for 20 to 30 minutes, savoring the build-up rather than racing to the end. This isn't a sprint, it's a journey that honors your body's rhythm. After, note how you feel. Energized or exhausted? Adjust frequency accordingly, sticking to that 48-72 hour window. And always, always listen to your body. If something feels off, pause and reassess. That brings us to those red flags I promised, the ones that scream, "See a doctor now." Don't brush them off. Early action can change everything. Watch for lingering pain post-session, sharp or burning, that hangs around beyond half an hour. It could signal inflammation or injury. New numbness, tingling, or altered sensations? That might point to nerve issues needing prompt care. Any visual oddities like swelling, rashes, unusual lumps, or persistent discharge, especially if it's colored or smelly, warrant a checkup to rule out infections. Urinary changes tied to your habits, trouble peeing, weak stream, or burning, could link to prostate concerns. Never ignore even a trace of blood. It's a potential sign of tears or deeper problems. And if erections suddenly falter during solo time, it might indicate vascular hurdles that deserve investigation. Gentlemen, talking to your urologist about this is easier than you think. We're trained for these discussions, and confidentiality is ironclad. Frame it factually. I've noticed this change during self-stimulation. What could it mean? You'll be glad you did. In wrapping up, remember that masturbation after 60 is a gift. A way to stay attuned to your body, nurture your health, and embrace pleasure on your terms. By going slower, gentler, with care and lubrication, you're investing in a future of vitality. Your experiences have shaped you. Now let them guide you to kinder habits. If this has opened your eyes, subscribe for more straight talk health advice. And if symptoms linger, reach out to a professional. Your well-being is worth it. Stay strong, stay informed, and age with the grace you deserve.